Everyone, this is Molly Lombardi. I am going to be doing the early childhood lecture. Early childhood is kind of an umbrella, and inside this umbrella we have toddler, which is age 1 through 3, and then the other side is preschool, age 3 to 5. This lecture is divided into two different PowerPoints. This is the first one, part 1, where we're going to go over growth and development, and then age group challenges. The next lecture on Blackboard is the part 2, and that is going to include nursing assessment, safety, and pain related to the early childhood development. So let's start off with growth and development. For the toddler and preschooler, we're going to break it up. We'll go over motor development, both fine and gross motor, language, cognitive, and social and emotional development. I've combined the different chapters for this one for both your Rudd textbook had a previous chapter on growth and development, which I picked out the age-appropriate information that we need. And then I've also pulled from ATI, and we're pretty lucky because usually there's a lot of variances, but this new textbook seems to be pretty up to date, and it follows ATI pretty closely, so there's not going to be too many variabilities between them. So let's start off by identifying what exactly growth and development is. Growth is an increase in physical size of a whole or any of its parts. So it's an increase in the number and size of cell, and this can be measured, either height or weight. And then there's development, and this consists of a continuous order, a series, if you will, of conditions that lead to an activity or new motives for activities or patterns of behavior. Both are individualized, so just because someone is 2 doesn't mean that they're going to hit all the 2-year-old developmental milestones. Everyone is going to hit milestones at a different pace. And there's also going to be fluctuation within meeting those milestones. You'll have moments where a child will have rapid growth and then all of a sudden plateau for a certain amount of time and then start back up again. So it's never going to be consistent and steady. They usually follow different patterns, kind of depending on what we are looking at for the development. There's cephalocaudal, which is head to toe. And you can remember this, that an infant first has control over head movement and then neck movement, and it works its way down through the body from that head to toe pattern. And then there's proximal distal, and this is where it starts at the center, and as they build more and go along the path of development, they're going to have that the milestones reaching out further. So first they're going to have that large motor motion of their arms, the large muscle, and then it's going to continue down to having more motor control in their fine motor, so their fingers. Next is differentiation. So this is simple to complex development. So that's, you need to learn to crawl before you can walk. You need to learn to walk before you can run. They get more complex as they are mastering and going up in the development. Now we're talking just about the toddler. So this is age 1 to 3. The toddler is going to grow between age 1 to 2, so the first half of toddlerhood. They're going to gain about 8 ounces a month and grow about 3 to 5 inches a year in that time frame. Then as they get a little bit older, so between 2 and 3, they're going to gain 3 to 5 pounds that year, and then they're also going to grow about 2 to 2.5 inches. Again, this is just approximate, and everyone's going to have their own growth pattern. And we're going to talk a little bit later in the lecture about charting the growth for height and weight in a CDC chart. So development, we have different theorists that go through developmental milestones according to their theory. This is more of developmental psych, which you have either already taken or will take, so I'm not going to spend too much time on it. I did include in here, so for Erikson, Piaget, Freud, and Kohlberg, I have different videos that I found on YouTube that were really easy to and quick just to refresh your memory on what each stage is. The reason why it's important for nurses to understand the stage is to give you a foundation to understand what stage developmentally that they're at and alter the plan of care to meet their developmental needs. Motor development for a toddler. So motor development is composed of two different categories. Gross motor, which is the large muscle, so running, jumping, standing, that's gross motor. And then fine motor, which is composed of the hand manipulation, usually it's the smaller muscles. And both motor development for a toddler is developing at a very fast pace. So by usually between 12 to at least 15 months, the toddler should be walking independently and no longer needing assistance like cruising that you were taught about for infants. They're starting to run, so again, crawl, walk, and then run. They're standing on their tiptoes. And this is a new skill. Sometimes they'll do this for a few months at a time when they first learn it and then go back to the heel and then pad. They will be climbing stairs. And not just stairs, really they'll climb anything. Stairs are going to be a little bit more independent. It's usually the dominant leg that goes first, and then the non-dominant leg will catch up. And then again, the dominant leg will step on the new step. And that's how they start off, by climbing these stairs before they're able to do a right, left up the stair pattern. They're going to build blocks, make towers out of these blocks, usually a couple blocks tall by toddler age. They can start to kick a ball. You'll notice that soccer usually has soccer tots because this is when they're starting to gain that skill, and it's fun and it improves foot-eye coordination in this circumstance. They climb on furniture. So they'll be climbing up on the couch, and we'll talk later in the lecture about the certain safety measures that the parents are going to have to take and the nurse will take while they're inpatient as well. They will start to pull and carry toys, and they'll load themselves up with as many toys as they can and bring them to another room to play with them. They will run and jump starting at age 2. And then by age 3, they can usually start to ride a tricycle, so a three-wheeled bicycle. And they will also learn the fine motor of being able to turn a doorknob. So this is when you start to hear about stories of how a toddler escaped from the house at night and was wandering along the street because the child safety door wasn't, the knob over the safety wasn't installed soon enough. Throughout this lecture, you'll notice that I have a lot of links on here, hyperlinks. For those of you who don't have children or have teenagers, so you might be a little bit rusty on the what a toddler would look like. So I've included the pictures. If you want to just click on the picture, it should play right in your slide, or there's a link on the bottom of it that you can follow. They're just short clips usually of the developmental milestone that I'm trying to show you, and a video is so much better with development than just myself explaining it. If you are completely comfortable, don't feel compelled to have to click and watch all these videos in their entirety. It's just to help you get a better understanding. Toddler language is interesting and usually a bit hard to understand. They can start to identify objects. So the video that I have here, this little boy is identifying objects that his mom is saying out loud. The toddler usually understands and knows a lot more than they're able to verbalize. So their language is a bit behind as far as the other development goes. They know the names of people close to them, so people in their family, their teachers. They have a small circle of people that they know by name. They're learning their own name. They are learning how that they have not just their first name, but their last name as well. They parrot a lot, so they may not understand the meaning of a word, but they will listen to their parents or caregivers, and then they'll start to try to explore it and say it themselves. So this is when parents have to be careful, and caregivers about what they're saying in front of the children, especially foul language. By 12 months, most children know about 5 words, And then if you can see this huge jump by 18 months, so just 6 months later, they go from knowing 5 words to 50 words. So that language kind of suddenly kicks in, and the parents just say that they're exploding with all of this new language, and it's wonderful to see that. By age 2, they're going to start to have these 2 to 3 word sentences. So usually it's something like me do, because they want that independence and they don't have the correct verbiage, but they'll say something like me do, I want. And then by age 3, it's 2 to 3 sentence conversation. So again, you can see how it just explodes, and they're using usually full sentences or pretty close to it, and 2 to 3 at a rip. They start to have the correct I, me, and you by age 3. So rather than I do, they'll say, I'd like to do that, or can I do it? So they start to have proper English a little bit here by the time that they're 3. The cognition of a toddler. One of the main milestones is that they can start to find these objects that are hidden. So before they had this, if you were to hide a block underneath a blanket, in their mind that block was now gone. But now a toddler will pick up the blanket and grab the block from underneath it. They're beginning to sort both shapes and colors. So the video I have here is of the sorting. It's a younger toddler, so he hasn't quite mastered it, but he's trying. They're beginning to play make-believe. So this is just the beginning stages of it again. But they're starting to have that imaginary and play dress up and play in the kitchen, do a lot of role modeling, make-believe play. They're beginning to scribble and show dominance if they're right-handed or left-handed. And this usually by the end of toddlerhood into preschooler, they'll have figured out which hand they're going to be a dominant in. But right now it's just scribbling, a lot of circles, and having the big crayons available for them too, because their fine motor, again, isn't quite developed as a preschooler will be. So that'll help in their developmental growth. The toddler social and emotional milestones, we're going to see that they're going to imitate others. So again, I said how they like to do the role modeling and play dress up, pretend to be mommy, and breastfeed the new baby that's coming. So they'll do that kind of imitating others. They are self-aware. They now know that they are their own individual. They have their own identity. And this is new for toddler, and it's going to continue to flourish. They enjoy other children and playing near other children, but they still have this parallel play. And the video here is a great visual and audio of what parallel play is. Basically, it is a toddler doing their own thing, playing with an object, and then another toddler next to him doing a similar thing, playing with a similar object, but they're not really interacting with each other. They're parallel play. They show affection, a lot of hugs and kisses, and very warm and fuzzy. They are also defiant, though, so this is where they get their bad rap, the terrible toddlers. They're defiant because, again, they are realizing that they're their own individual, and that they want their own choices, which we know aren't always best for them. Separation anxiety is still here. It lasts until about 2 years old, and we'll talk about separation anxiety a little bit further in this lecture. If a new sibling is coming along, they will be pretty jealous of that new baby. So we have to be cognizant of that and make sure that there's safety for the new baby. Not that they're going to try to harm them, but they are jealous and don't know their strength at this age either.
I'm a son, is away. The boy here, but he's not strong. He's not strong. How about this kitty cat I brought? How about the kitty? Well, Pluto has one, but he's not strong either. It's October. It's all day. Ballerina Chulo. All day long she was yelling, run, run.
So that finishes the developmental milestones for a toddler. So they've reached 3 years old, and now starting at 3, we go into preschool, which is 3 to 5. This here is a video that just kind of sums up the, where they should be developmentally for a 3-year-old. Preschooler growth and development. So again, this is age 3 to 5, and the gain is going to be easy to remember because they're going to gain about 3 to 5 pounds each year. They will grow about 1.5 to 2.5 inches each year. Again, the best thing to do is to plot them on the CDC growth chart, which we'll go into. The theorists for couple stages, they've changed. So Erickson, they are now in the initiative versus guilt stage, where before it was the autonomy versus shame and doubt. Piaget, they've stayed the same, still pre-operational. Freud, they have changed. They were in the anal stage in toddler, and now they're in the phallic stage as a preschooler. And Kohlberg here, they've stayed the same. Pre-conventional stage is still there. So they're the same videos, but I've just fast forwarded to that particular stage if applicable. Preschooler motor development. So you'll see by 3, 4, 5, I've divided it up. Again, motor development is both large and fine. So by 3, they should be able to dress themselves with some help, especially with the buttons and zippers are a bit challenging. They're able to go up and down stairs now. Before it was just up, but now down is independent. They're drawing clear circles, squares, and triangles. And they're learning how to use utensils like forks, spoons, and also they can drink from a cup. By age 4, they are going to hop and stand on one foot for about 5 to 10 seconds. They will throw objects overhand and also catch a bounced ball. Of course, it should be a slow-moving bounced ball. They're going to draw stick figures now, usually with 2 body parts, or they almost look like a potato head figure, but they start to have some defining characteristics as a person. And they're using scissors. So like I said before, they're going to now have a dominant hand and use scissors with that dominant hand. It's usually easier for them to start off on thicker paper, almost like cardstock or postcards, and start cutting with that before they move to thin paper things. By age 5, they should be brushing their own teeth. They still should have that adult supervision during the teeth brushing and making sure that they're getting all of their teeth, and may need help with the back molars at first. They are learning to skip and ride a bike. The training wheels are usually coming off by around 4 or 5. And they're also learning swimming, which is more of a life skill and a safety skill that they should have down by age 5. You'll see I think this was my daughter who wrote her last name here on the paper. And you'll see that it's mostly, this was age 4.5, I think, and it's mostly composed of just circles and lines. You'll see the B and the A are pretty hard for them at this age group still, but they're starting to get it. I've also, again, included a video here on this is more the large motor development displayed in the video. Language development for a preschooler. Now we're able to understand them a lot better than we were in their toddlerhood. Most 5-year-olds, you should understand about everything that they say. Age 3, it's still a little bit difficult, but you should understand if you're used to them and in their close circle. And they use about 3 to 4 word sentences. Age 4, they're going to use about 4 to 5 word sentences, so you'll see it slowly goes up. And then by age 5, they use 5 or more word sentences. They're able to tell stories, and the stories they tell are usually magnificent. They have future tense now, which is new. They understand rhyming, so the Cat in the Hat, Dr. Seuss books are wonderful for this age group. They state their full name and address by age 5, and that is a safety measure that all children should know their home address. They have concrete or literal interpretations of language. So again, it makes it storytelling so much more fun. You'll see the video is this preschooler telling his story of his day. Cognitively, the preschooler is going to start to recall parts of stories a little bit in more detail, as you saw in the video previously. They can row count, which is counting consecutively from 1 to 10, so 1, 2, 3, 4, 5. But they don't really have a good concept of what numbers mean, and even though they count 3 markers, they don't understand that the number 3 means 3. They know at least 4 colors, usually the primary colors. They start to understand time, usually morning, evening, night, not necessarily full clock time. They understand what's same and different, so they'll understand things about themselves that's same and different, and also genders. They have quite the imagination and creativity, which you'll hear in their stories and in their dressing up and playing. And they ask a lot of why questions because they're exploring the world around them and they want to learn as much as they can and understand it. The social and emotional milestones of the preschoolers are displayed here. So you'll see that they're becoming more independent, and they want this independence, and they're very proud of their new abilities to do things themselves. They are interested in learning new things and exploring everything around them. They're now obeying rules a bit more than in toddler. So remember, the toddler was disobedient and defiant, where now according to different theorists, there's different reasons for it, but they're starting to obey these rules nonetheless. They're engaged in role playing and associative play, so they're starting to play with other children around them. Role playing is displayed in the video I have here of my son shaving. They like to try to problem solve and come up with different solutions. There's a blurred line between fantasy and reality, and this is usually an unfortunate thing. It's great that they have this magical thought and fantasy when they believe in Santa and Easter Bunny and the Tooth Fairy, but when it gets hard for them to understand is that things like monsters aren't real, or zombies are, a fantasy. That's really hard for them to understand. So usually you'll have some nightmares and scared of the dark. They're understanding the differences for gender and racial. So again, they're understanding the same and different. They're exploring their genitalia through masturbation, and this is a completely normal thing that occurs. It's a developmental milestone, and it's important. Some parents get upset about this or tell them it's bad or shameful, and it's important for them just to explain that it's normal, but it should be done in privacy because it's a private area. They're still jealous over the new arrival of a sibling, but not as much, or at least they have more control over their feelings and emotions a little bit better than when they were toddlers. So now we're going to put the toddlers and preschoolers back in the same category as early childhood, and we're going to look at age group related challenges. They are potty training, separation anxiety, tantrums and discipline, nutrition, and dental. So the first one is potty training, and this usually begins around age 2 to 3. Again, just like their developmental milestones, the readiness is at an individual pace. Signs of readiness that you can relay to parents are having dry diapers for hours either during the day or during nap time, and they also have a pretty regular bowel pattern. The next readiness sign is that they're interested in it, and I mean the toddler is interested in it. They verbalize when they need to go to the bathroom or when they have already wet themselves. And they also have the physical ability to undress their pants, so they have to have the fine motor skills to go along with it. Maybe not to button or zip, but at least to pull up and down. And parents who are potty training should have clothes that are appropriate for them to use themselves. You can encourage parents to allow the child to sit on the potty for several minutes at a time. Have them start the good hand hygiene. Instruct girls to wipe from front to back to avoid UTIs. And at first, boys are going to sit to urinate, and then later they can stand, and usually they'll start doing target practice to get them to go to the bathroom standing up for urine. And then also you want to encourage parents to praise good behavior or good potty moments and not punish them when they have accidents. So that's a key guidance for parents. The next is separation anxiety, which we touched on briefly before. So again, this begins at 8 months, so very young, but it peaks at 10 to 18 months, so in that toddler range. And it usually lasts until about age 3, depending on the child. It's important to know and to tell parents that this is normal. It's part of their development. But it's caused from distress, a fear of abandonment, so that the toddler's worried that the parent's leaving and never coming back. So to help with these separation anxiety moments, and this happens sometimes quite often in the hospital where the parents can't stay all the time with the child. So some guidelines is to have the child say goodbye to the parents to know that they're leaving, but to also distract the child during the leaving. So have them active in play with a toy or something with the child care, either provider or nurse. And then have the child, while they're active, the parent's going to leave very quickly. The longer that the parent kind of hangs around or comes back, and it makes the separation anxiety tantrum or crying afterwards, it makes it last longer. So while the child is crying in this distressed state of mind, it's important for those who are still with them to remain calm and be consistent and reassure them that their parent will return. Tantrums and discipline. Remember, this is also toddler. It's toddler and preschool. So tantrums are most significant between age 1 to 4, although tantrums are known to last for an older age group. And this is a way for the child to express their anger and frustration. Again, they don't have a lot of language abilities, and they have all these emotions and fears, and they don't have much of an outlet to express it verbally. So this is the way they do it. I did do a hyperlink to a tantrum here for those of you who need a little bit brush up on what a tantrum looks like. A tantrum is displayed usually by a whining or crying or even screaming at the top of their lungs. They're sometimes hitting or kicking or scratching and biting to anyone that's near them, including younger baby siblings. Sometimes they'll also hold their breath. My brother did this. He'd hold his breath until he turned blue and passed out. It's triggered by a lot of different things. So they might be hungry. They're not going to tell you they're hungry. They could be tired, and usually when they're overtired, you have an increase of tantrums. If they're uncomfortable or sick, overstressed, or also attention seeking. Usually this is older when they've realized that if they throw a tantrum, they could get what they want. But usually when they're younger, it starts off from these genuine needs that they don't have a way to express. So you can imagine if you have a tired, uncomfortable, sick, overstressed toddler or even preschooler in the hospital, you're going to see a lot of tantrums. So your role as the nurse is to guide parents as well as handle it yourself if the parent's not there. Again, stay calm and collected. Try to keep your wits about you, and sometimes you'll need to walk away, and that's okay as long as they're in a safe environment. But there should also be consequences for poor behavior. So remember that the attention seeking, that's for the older child when they realize that tantrums can get them something positive. So if they did something bad, like the hitting, kicking, or scratching during it, there should be a consequence. So something like a timeout in a quiet place until they're calm. Routine is going to help decrease the frequency of tantrums. So having their bedtime routine, that's so important to this age group, continue as much as you can in the hospital setting, or at least meal times or something that they're familiar with. If they know what to expect and what's going to come next, they're not going to be as overstressed or uncomfortable if they have an understanding of it. Again, they're going to decrease by about age 4, and this is partially due because their language skills are increasing. So they're able to express themselves in words and not so much through these tantrums. Nutrition. So toddlers are going to be eating about 7 times a day. This includes snacks and meals. They are constantly eating, which is hard because they're on the go, and because of safety, you don't want them running around while they're eating. So a lot of short, frequent meal times and snack times are best for toddlers. Preschoolers, they're going to have their 3 meals and a couple snacks a day. It's usually about 5 to 6 times that they will eat a day. While they're in the 1 to 2, the toddler age group, so 1 to 2 years old, they're going to be having whole milk still, about 3 a day. And then once they hit 2, they should be switching over to either partially skim or full skim milk, and along with other dairy, so healthy dairy like yogurts and cheese. That's going to be 2 per day for the milk. You want to make sure that their nutrition is well balanced. So a lot of guidance for the parents, because in this early childhood age is when they develop lifelong eating habits. So they should have lean protein, fruits and vegetables. They should have their dairy, whole grains, just like an adult diet should be, except for you want to avoid choking hazards, which we'll get into in the next part of this lecture. But nuts are great because they have protein, but not under age 2. Some even say age 3. And peanut butter is a great way to get around that, so they still have the nut nutritional value, but it's in a safe way to consume it. Portion is about half that of an adult. In ATI, it tells you exactly how many tablespoons per month. But just know that it's about half of what an adult should consume. So their calories should be about 1,000 to 1,500 calories a day for the 2 to 3-year-old. Self-feeding, this is really important for a couple reasons. One, it'll help reduce overfeeding. And it's also, which we know that obesity in America is an epidemic. So it's going to help decrease that at a young age. And it also increases motor function because remember, they're developing that fine motor skill. So being able to grasp the food themselves, and then later they should be able to manipulate it in a more fine way. They're going to have food jags and appetite fluctuations. So they are going to be anorexic for some point of time, and they won't eat at all, and that can be very alarming for caregivers. But just know that it fluctuates, and then all of a sudden they're going to be eating you out of house and home and constantly on the go again. They're also very picky eaters. So sometimes it's difficult and very challenging for parents to get in the appropriate amount of fruits and vegetables or protein or iron. It's difficult for them to get it in. So just having a lot of healthy choices constantly available will help that. Limit juice. A lot of, like when I was younger, juice was always considered such a healthy option for children to drink, and we drank it all day long. Now we realize that it's high in sugar content and it's not the best thing to drink. They should only have about 4 to 6 ounces a day. That's about 1 cup to 2 cups if they're small. The best thing for them to drink besides their couple, either 2 or 3 servings of milk is water. You'll see a lot of advertisement from public health, like on city buses and what have you, to drink water, just plain water. And again, the eating habits that they're going to have for the rest of their life start now. So that's why it's really important to stress this for parents. The children at this age have a really high metabolism, so their obesity doesn't show usually as much. But if they're used to eating high calorie, poor nutrition food, then that's going to catch up to them when they get older. So earlier in this lecture, I talked about how the preschooler can start to brush their own teeth. You want to be very careful about making sure that the parents are still there during the brushing, like I said, to observe for it, for proper brushing. A public health problem is dental cavities. And they can be extremely painful and cause infection. As you can see in this picture here, it's so sad. The teeth are black because they're rotted, and left untreated, again, extremely painful. And this can be an easy area for bacteria to get in and cause an infection. It's also expensive to take care of. It's a preventable issue. Typically, so it's expensive to have to take care of the teeth that look like this, either through pulling, extractions, or caps. There is a relationship between dental cavities and child mistreatment and or neglect. So it's not a complete, but there's a relationship for it, meaning that just because someone has a cavity doesn't mean that they're being mistreated or neglected, but it is more common in households where mistreatment or neglect is present. It can, dental cavities can help be avoided by age 1 to 3 using fluoride toothpaste. It's only the size of a grain of a rice, and this is morning and night, so 2 times a day. And age 3 to 6, again, still fluoride toothpaste, but it's a pea-size amount in the morning and night, so a little bit larger. And this is because they're spitting. They should make sure that they're spitting out the fluoride toothpaste. They should floss daily once they have at least 2 teeth. And even though the teeth aren't always touching, like in this picture here, it again helps develop the habits, the healthy habits that are going to be continued throughout their life. The dentist should be visited by age 1 for the first time, and then continue to be visited every 6 months for the rest of their lives. In the picture on the right-hand side, this is what bottle rot or baby bottle cavities look like, and this is caused from the bottle being constantly in a mouth that's too old. They haven't transitioned over to a cup. Or another cause is that they had juice in their bottle. So, it should only be milk for when they need it through the bottle, or water even. It also increases this baby bottle cavities when they sleep with a bottle at night, because the nipple is constantly dripping out the material, either juice or milk, which still has sugar in it, and it is sitting on their teeth all night long. So the idea is to have them brush their teeth before they go to bed, and then nothing else in their mouth, maybe a pacifier, but no sugar-containing liquids should be going in to help avoid the baby cavities. That is the end of part 1 of early childhood. If you would go on to part 2, where we're going to go into more of the nursing interventions and assessment part of this lecture. Again, as always, if you have any questions, please, I encourage you to email me before lecture. There's my email right on the screen, and I'd be happy to get back to you either through email or during lecture if a lot of people need some further help.